All right. So thank you all so much for coming today. For August, Mary Bridge Children's and Kids Mental Health Pierce County are collaborating to provide this great presentation on substance use disorder and youth. Presented here by Shundra King, who is from For the Culture Counseling Services. She has been a connection for us when I was working at Mary Bridge Children's. I would do lots of referrals to their organization in order to support our youth coming in, needing to get connected to treatment services, specifically for a lot of our kiddos who are on opioids. She was a great connection and resource and had a wonderful turnaround. And so I thought it would be a great opportunity to highlight the services that they provide. Shundra, I'll go ahead and let you introduce yourself and we'll switch over the slides so that you can go ahead and start.
Thank you. Hi, I'm Shundra King. I'm the Executive Director and CEO at For the Culture Counseling Services. We just celebrated our 4-year anniversary on April 1st of 2025. So we are happy to be here and we are continuing to grow and add services as we're going. I recently got credentialed for mental health services. So that was an exciting thing for me. I had not planned on working with youth, but I think the universe was like, you're working with youth because that was a lot of my referrals. And so I had to log in with the MCOs and change my age to 13 and over instead of 18 and over. So that was a journey. So I am excited to be here and give you a brief overview of substance use disorder with youth and tell you a little bit more about our program and services that we have.
Wonderful. So we have a Q&A option. So if you have questions, feel free to drop those in the Q&A or in the chat. I'd love to see for people to go ahead and introduce themselves in the chat as well so we can see who's all here. A lot of our attendees are from Pierce County, I believe. So it's not just our Mary Bridge social workers and staff, but also some of our community providers as well. And then, yeah, I'll go ahead and switch it over to you.
All right, I am going to share my screen. And anyone who would like a copy of these slides, just let us know, and I'm happy to make sure that you get a copy of them. Great. Is everyone seeing my screen?
Yeah. Yes, we can see it.
Okay. I didn't know if I should go in slide mode because it's kind of weird because I have a double screen. So I'm probably just going to keep it like this. But if it's too small for anyone, just let me know. Great. So we are going to take a brief look at the youth SUD crisis and why early intervention is important. So there has been a large increase in opiate use with youth. Typically, when I started services, our youth were using marijuana and alcohol, and that has changed dramatically. Early onset, lifelong impact. So over 90% of adult substance use disorder begins during adolescence or young adulthood. And we kind of miss these individuals. Like most of our adults that we work with started around the age of 5 using illicit substances. We also screen our individuals that come in, and we learned that a lot of them didn't have access to services just with the stigma around substance use disorder and just reaching out for services. And so it's very interesting to see that, that they had started at this age and weren't able to access those services. Increased vulnerability. So early substance use initiation drastically raises the risk for addiction, mental health disorders, violence, and academic failure. Majority of the youth that we see coming in around this, a lot of it is mental health and academic. A lot of our youth are not just picking up substances and using it, it's environmental or past traumas or experiences that they've had. We've seen an increase with domestic violence with youth and parents, but most of those youth are homeless individual youth. The U.S. opiate overdose deaths surged 200% in a decade with 100,000 plus overdose deaths in 2021. And as we all know, that continues to increase. Screening for youth substance use disorder is the first step. Primarily, we would like to see the screening happening with pediatrics, so with primary care. A lot of that is not happening with a lot of the youth that we see coming in. So These three screening tools right here are very beneficial for youth when it comes to screening for SUD. And I'm not sure if anyone's familiar with all of these screeners. The CRAFT screening tool is good for ages 12 to 21, and it focuses on car safety, relapse, forgetting friends, family concerns, and other trouble. Gonna see if I don't think I'll be able to launch the link, but I can post these screeners in the chat as well. And if you have access to the slides, you can click on the link. Um, and then we have the screening to brief intervention. So this is a quick assessment of frequency of use across multiple substances, guiding intervention and intensity. So this is a really, really good tool here. And then the brief screening for tobacco, alcohol, and other drugs. So anyone that's working with youth and want to get a glimpse of how severe their substance use is and like where it's impacting with them, these are the three screeners that should be used. And these are the screeners that we use with our youth as well. So again, the screening is not meant to like diagnose, it's to kind of get an idea of like where the youth are. And based on how the youth answer the questions, there will be a recommendation and a referral for extra support and or treatment. Psychosocial treatment for youth. So what we've seen work for youth is family-based therapy. So here at For the Culture, we treat the entire family. So if a youth comes in for services and we assess them and we admit them, the whole family that resides with the youth has access to us. So what that means is there may be a parent, guardian, or whomever in the family who has concerns or they're feeling overwhelmed with what's happening with youth. As we know, substances like when they're using it kind of changes the way that they think and they function. If they're feeling overwhelmed and they need just an outlet, they're able to come in and have an individual session with us. The youth does not need to be present for that. So we believe addiction is not just the youth and the individual, it's the family, the whole entire family is affected. So typically youth that are successful in treatment, there's a family-based therapy that's used, and that's when we see a higher rate of the youth being successful. Cognitive behavioral therapy, youth or adults, just understanding their thinking and behavior and how that's linked. Dialecto behavioral therapy, this is a good one because with that is distress tolerance and emotion regulation, and just mindful, getting the youth to be present in the current moment. So with those three being used, we've seen an increase in improvement with youth. We do implement these in our treatment services here in our groups and our individual sessions. Some more promising interventions, motivational interviewing. This one is really important to youth because sometimes we get youth that come in that don't want to change. They don't want to stop using. You have to have the patience to work with these individuals because a lot of them come in that way. And so the goal is to kind of see where they are and identify like where they want to change and meet them where they are. We use more of a harm reduction than abstinence based here. And so motivational interviewing works for us with the youth. Third wave CBT with mindfulness. And so this is similar to our basic CBT, but this one just really helps the youth to explore and be in tune with like why they're feeling the way that they're feeling. So this one is a more newer approach. Contingency management has been our best friend. So when we have our youth here, we do gift cards with permission from the parents, parties, just anything that we find that they're into that motivates them to be here and get involved into treatment, we do that. And we do notice that most of our youth will stick the program out and complete the program with contingency management. So that one is super important. 12-step programs are a little bit challenging for our youth just because there is not really available for youth. And so some of our youth coming in, their parents have them attend adult 12-step groups. It could be good and bad. The bad thing is that they don't really relate to the adults because they're older. But the good thing is they have shared that, they're able to see like, if I continue to use substances, like I could be like this person. I could be here, 30, 40, 50 years from now, like talking about my problems, and they get to see how it impacts their life as they're growing up. So it's really hard to find the 12-step program for youth, but peer support groups, we do offer those here as well as treatment groups, and these ones are more beneficial for youth But again, it's really hard to find those. So we've had youth throughout our summer program talk about their willingness to do some or start peer support groups at school. So we're really trying to encourage them to do that. And that's without the clinical support. It's more of them being in control of their recovery and kind of running that group with their peers. Medication for opiate use disorder in adolescents, it does very much exist. Despite strong evidence supporting their effectiveness, medications for opiate use disorder remain drastically underutilized in adolescent populations. And the biggest part of this is just the stigma. Um, and also providers like having that hesitancy of prescribing the medication to the youth because they are youth. Sometimes there are insurance restrictions that make it hard for the youth to have access to that. So the FDA has approved buprenorphine, methadone, and naltrexone for youth who have an opiate use disorder. We've had a few youth in our program who use these type of modalities, and we have seen that it does work with them. And so typically when we have youth who are on MAT, medicated assisted treatment, we have them sign a consent form because it's really good to coincide their services. Like we want to make sure that they're going to their scheduled appointments and they're, getting their correct doses. We check in with them at every session to make sure that they're stable, they're not feeling any withdrawals complication, and just really teach them to advocate for themselves. Like if they're still experiencing withdrawals or if they feel like maybe their medication dosage may be too high for them. So that's kind of like where we come in, is like really teaching them to advocate for themselves. So youth who are involved in MOUD specifically reduces the opiate use, overdose risk, and improves retention and treatment programs. And again, we've seen it go both ways. We've seen youth who do not access the MOUDs, and we typically lose them because they'll drop out of treatment. And then we've had individuals who were enrolled and they were able to stay in treatment and complete. I think the biggest thing for us too that we've seen is the lack of education with parents as well. And so when they think of, any type of medicated assisted treatment, they kind of think, okay, just adults can have that. And so they're not really educated on youth being able to have access to this. So again, that's another piece and component where we come in when we're serving these families and we're letting them know like this is available for youth and just having them reach out to their primary care. Did I lose you guys? Am I still there?
You froze for a second, but you're
Oh,
back.
okay. Yeah, I'm sorry. Our internet is kind of wonky. This picture here, this is youth-centered recovery. So in order for youth to fully get the benefits of recovery, we want to make sure it's holistic, strength-based, and goal-driven care. So when screening individuals, understanding if there's a mental health component, in order for them to be successful in their recovery from substance use, they do need co-occurring treatment. So mental health, so therapy, coping skills, trauma care, that is going to be super important. Harm reduction, safer use strategies and education. So again, for the culture, we use a harm reduction model. We want youth to have an understanding of what harm reduction looks like, what abstinence-based looks like. We want them to be able to have an understanding, get the education around substance use disorder so that when they do get older, that they can make decisions about what they want to do. So we always tell them our job here is to provide the education and support for you. And then when you get older and you decide that you want to use, allow you to make a decision about what you're doing. Family
Hey,
support is super
Shundra,
important. So,
I'm
can
going
you
to
hear
pause
me?
for just a second. Yep,
Yeah.
I can hear you, but it looks like someone is not able to see the presentation, just a speaker. I just want to
Oh,
cross-check, is that happening across the board? If you can
yeah.
reshare.
Yep. I'm resharing. Hold on.
Thanks so much. Thanks for letting us know,
Oh,
Kimberly.
yep. Is that better?
I can see it.
Okay. Social support is super important when it comes to youth. The biggest barrier that we see is the family involvement piece. We've seen success with our youth when family are involved in their recovery. We do educate the family on, how to recognize when the youth is under the influence and how to support them and just different approaches with the youth. Families definitely appreciate that. Peers and supportive network are important. And then also the physical health. Are you eating? How's your sleeping going? Are you going to see a primary care doctor? So all of these things combined in conjunction are a great way to keep the youth sober while they're in recovery and also once they complete treatment services. The current trend in substance use. So cannabis is the most common substance with the increasing potency and novel consumption methods raising concerns. So majority of our youth have gotten smart with the cannabis and are using the vape pens because there is no smell with them. They have easy access to it. Again, the marijuana has always been the biggest thing. It's typically the first substance outside of alcohol that we see youth consume. Alcohol is declining right now with the youth that we see coming into our program. So a lot of the times, again, we're seeing a lot of the time we are still just seeing a lot of the cannabis use. And then we have our opiates. Again, opiates are a newer trend for our youth. When we first started seeing youth, it was more cannabis and alcohol. So we are seeing an increase in fentanyl use with our youth. Mushrooms are rising with our youth. When we had one of our group sessions, one of our youth opened up about it, so everyone started talking. So we found out that mushrooms are not detected in a UA sample. And so typically a lot of our justice involved youth that we have will use mushrooms because they still want to get like that high feeling, but they also don't want to get in trouble. So we have seen a huge increase in mushrooms with our youth. Cocaine is still present, but it's not as high as what we see when it comes to cannabis and opiates. So again, typically as we're doing assessments right now, our primary diagnosis for our youth are alcohol, cannabis, and opiates. So what can you expect when referring a youth to for the culture? So warm handoffs, we really appreciate that, just getting perspective from you as from the provider with information about the youth, the family, and anything that you feel that we need to know in order to make that youth successful in their recovery. Each youth that come in complete a biopsychosocial evaluation so that we can determine the appropriate level of care that they need and also create their individual service plan. Here at For the Culture, we offer an outpatient program for youth, which is 6 months. We do an intensive outpatient program, which is a year. And then we also do a relapse prevention. It's like a relapse prevention early education, and that is 90 days. Treatment includes 1 to 2 weekly groups plus a monthly meeting with the counselor. Some of our youth, we do partner with a certified peer because not all of our counselors here have the lived experience of substance use. And so any of our youth coming in where we feel that they need more support, we will partner them with a certified peer who has that lived experience and can work with them and support them just a little bit more. And again, we offer family-centered care. This is a family disease. It's not just the disease of the individual that's enrolled into our services. Making a referral, the easiest way to refer a client to us is to complete our HIPAA compliant referral link. We do check the HIPAA compliant referral link before we go to any emails that we may receive. And it's just easier for us to keep track of all of our referrals in one area. Sometimes we do get urgent requests from providers, which is fine, and we'll get like a phone call or an email and we're able to accommodate it. But the easiest way for us to get the client's profile set up and reach out to the client is for the HIPAA compliant referral link to be completed. It's very brief questions. The link is here. It's on the slides. We're happy to share that. It's also in our email and on our For the Culture website. If there is an urgent need for a youth who need services immediately, our direct line that's listed here can be called. And then there is also the link to our website. And while we have time before we do Q&A, I'm actually going to stop sharing my screen and pull up some of these screeners because I do want to show them to you for those who have not seen the screeners.
While Shundra is getting those screeners pulled up, if you have questions, feel free to add them to the Q&A or to the chat. I know I've been posting questions in there. And then also feel free to unmute yourself once we get to that Q&A portion after she shows those screeners. Chandra, it looks like one of the questions was around if Medicaid is accepted at your program.
Yes, so we only take Medicaid. If you live in Pierce County and you do not have insurance, we have a grant through Carillon, and so we can provide free services to the individuals that reside in Pierce County only, because we do have another office location in King County. So yes, we only take Medicaid. We've had special situations where we've had youth come in and they're under their parents' commercial insurance. And so with the Carillon funding, we're able to exclude the parents' income and insurance from that and also serve the youth. So we've always been able to find a way around making sure that the youth are served. And we're in contract with all 5 MCOs, and that's also listed on our website. So here's one of the screenings. This is the screening to brief intervention. And so you'll just go through the questions with the individual. Of course, if they answer never to all of these 2 questions up here, then you will continue to the questions on the back, which are here, which talks about prescription drugs, inhalants. So this kind of just gives you an overview of all the substances that the individual may have tried. And here is the craft screener. So this is asking the youth in the past 12 months how many days they use any alcohol, how many days did they get high on anything other than marijuana, like over-the-counter medications, how many days did they use marijuana. And for youth, we have to be specific. We have to know street names to it because they'll be like weed or, So it's really important to have knowledge of the current terminology when it comes to substances. And we let youth know that it also includes synthetic marijuana like spice. And so with the craft, there's the part A and then the part B. So then this talks about the car, relaxation, alone, forgetting family and friends in trouble. And so what you'll do is the youth will answer yes or no to these questions. And then with the craft screener, once you scroll down to the bottom, it'll give you an idea for how to grade the individual, like how many points that they have, and if they need to be referred to any treatment. And then so this is the brief screener for tobacco, alcohol, and other drugs. So with this one, again, it'll look at the past year, and this one looks at cigarettes, alcohol, and cannabis. So they want to know in the past year, how many days did you smoke cigarettes or use any tobacco products? So with this, they need to give you the amount of days out of the year, how many times they use those substances. And then when you scroll down, in the past year, which of the following substances have you used? So the youth will check whichever ones. If it's none above, then you wouldn't move forward. In the past year, how many days did you use the substance? So if they were to use crack cocaine, for 5 days, heroin for 3 days. You kind of want to identify how many days and numbers that they use the substances. And then in the past year, which of the following medications have you used that were not prescribed to you? So this is when we get into Xanax and Ritalin. It's super important. And for us, when we have youth coming in, especially doing the screener, if they're telling us that they're using Xanax or any Ritalin or over-the-counter medications, we always ask, was it prescribed to you? Because we have to explain to them that it's illicit if it's not prescribed to them. And so sometimes they think because, it's NyQuil or if it's cough medicine or anything like that, that it's not illicit, but it is. And so how you add it up is you look at the substance identified. So you will write down all of the substances that the youth identified. And then in order to determine the level, which I can send this over to, so this kind of looks at the level. So if there's no substance use, then their level would be a 0. If there's a 1, they have a lower risk. And if it's 2, it's a higher risk. And so what that means is the lower risk is if the substance has been used once in the past year. So let's say they're using cannabis, but they only used it once in the past year, then they have a lower risk for substance use. But if they used more than one time, then they have a higher risk if they use more than once in that past year. And again, it's looking at everything: tobacco, illicit substances. And I can also send this over as well, because you kind of want to go through the screener just to identify if they're lower risk, what kind of support should I have? If they're a higher risk, like where should I refer? Or if I should refer, sorry. So these are the 3 screeners.
Wonderful. Thanks so much for sharing all of those resources and information. We do have a couple more questions in the Q&A, so I'll go through those with you. So someone asked, how often do clients meet with a peer at your agency?
At least once a week minimum. So that's a face-to-face interaction, but they also have access to doing video and phone calls. So that peer is just readily available for them.
Is there any specialized training to be able to do screenings with clients that you would recommend?
I would just say reviewing the screeners and looking at how to score them. So there's not really any special training, because most of the screeners will come with an additional page that'll show you like how to score each screener so that you know how to refer the client.
Do you accept fee for service Medicaid?
Yes,
And then can someone receive only peer services and continue doing individual therapy with someone outside of the organization, excuse me.
absolutely. So our certified peers that we have here are for community, as in if there's just anyone in the community who needs a certified peer and they want to connect with horticulture, or if you are enrolled in our program and it's in your treatment plan that you have a certified peer. So absolutely.
And then how do you work with engaging the caregivers in your treatment? And then a caveat, how do you address or can you speak to confidentiality when it comes to this population?
Absolutely, our favorite thing. So typically when a parent, because we have an influx of parents bringing youth in, so we would have the parent and the youth come into our office. Sometimes the parents like to share things that the youth may not share with us during the assessment. So we do allow the parent to come in to kind of give us any guiding information. During the actual assessment, we only have the youth in the office. Once the youth completes the assessment and we determine that they are going to enroll into our program, we go over the release of information with them. We like to have them sign a release of information for their parents if they're open to it, but we do go over it and allow them, like, do you just want it for, emergencies? If we're not, if you come to treatment and you're intoxicated or something happens, is that the only reason why you want
You
to know about
froze
your UAs?
second, Chandra, when you were talking about having them sign the ROIs for parents and discussing what information exactly you would disclose to those that they sign the ROI for. There you go. You're unfrozen now.
Okay.
Did you catch what
Yeah,
I shared?
I just switched Wi-Fi, so hopefully this one's better. Yeah, so we do go over the release with them because some youth are just like, hey, I need my parents to know everything, so they consent to that, and some of them are like, they can know everything but my UAs. Like I don't want them to know what my UAs are. So we do go over that release of information before we allow the parent back in. So after the youth signs the release of information for whomever, whether it's parent or if they're legally involved, then we will bring the parent or guardian in, and share what the assessment results were, and we'll do treatment planning. And so we'll have the parent involved in, as long as it's okay with the youth. Typically, they like the parents to be in. They don't really know what a treatment plan is, and so we're like, these are your goals and things that you want to focus on while you're in services. So since I've been here, we haven't done a treatment plan where the parent was not involved or the family. So when we do initiate that treatment plan and we're talking about goals, that is the time that we have the caregiver or the family involved. Um, and of course, before they leave, we do let the parent know there's a consent form. These are the things that we're allowed to release to you. Because the youth is over 13, there's certain things that we just can't share, but these are the things that they did consent that we can share with you. So we do let them know and inform them because, of course, they want to be involved in everything. We haven't had any real pushback.
Looks like we may have lost you again, Chandra, if you can hear me. All right. Well, yep, it looks like we lost her. So I'll go ahead and end the training here. I see that there was another question that came in from Coral that I will make sure we get a response on and send that feedback to you directly. As mentioned, this training was recorded, so we'll be sure to send out that recording as well as the slides so you can review them at your own time. Were there any other questions in general for Marybridge Children's or Kids Mental Health Pierce County? Feel free to unmute or go to the chat. All right. Well, I appreciate everyone's time, and I hope you enjoyed and felt like you learned something from this training and experience. We will likely have more as things continue. So thank you so much. We'll get the recording and those slides out to you as soon as possible. Have a great day.